think the key to becoming a great acupuncturist is to become confident and competent in a range of skills, to develop your knowledge and understanding, of course. It's also about learning to work flexibly and creatively so that you can respond to each individual patient that comes through your door. And the secret to developing all that is to be taught by leading practitioners, and that's what we have here. We have a great staff of people who are all out there in practice themselves, doing good work. You actually develop a different way of seeing the world and seeing yourself and other people as you learn this subject. You learn to work with people's bodies, with their feelings, with their whole life stories. You also, importantly, learn business skills and how to set up a practice, which is crucial. So when you put all that together, that means you can go out there into the world and really make a difference to people's health and well-being.
Basically, I like the idea that it treats the whole person. In Western medicine, if you visit the doctor with a sore throat, he'll treat you for a sore throat. He won't look at maybe why you've got a sore throat, other issues that are going on, and things that are wrong with your body in other places. And that's the thing about acupuncture, so it treats you and balances your whole body, and that's the thing I like about it the most.
I just like the things that it can do. It's very, very versatile, and it helps people. That's basically it.
I always make a point of being there for the first day when students start their studies, and you can see the excitement of starting out on this new journey at that point. And then I also make a point of being there for the very last day when they're finishing their course. And I always ask the students, what have they got out of it? And the thing that comes out most frequently and most strongly is people talk about how much they've changed. And that's very interesting. There's something about studying this whole area that really changes people in all sorts of ways. We have about 100 students here at any one time, so we're quite a small college, and that makes it very friendly. It has a lovely atmosphere, a real spirit to the place, which I really love. And it also means that students get lots of support, and a lot of that's informal. It's because they know the staff, we know everyone by name, and of course the student groups get to know one another very well, and there's a lot of support there as well. There are also more formal things, so we have personal tutors for every student. The clinic supervisors get to know individual students extremely well. There's a counselling service. We have learning support tutors to support students who maybe need a bit of extra input on essay writing or something like that. So both informally and formally, there's a lot of support for students as they go through their studies.
They've got a real kind of pastoral, they consider pastoral care here, in a not a hands-on sort of soppy way. I mean, but they are very. They're concerned that we all pass. They're concerned that we all get there rather than pass, actually. It's more than just passing. They're concerned we make it. Every one of them. It's great.
I teach Kung Fu and Tai Chi, and my teacher came to this college years and years ago. He was probably, the first group through or one of them. And he recommended to come, and he was trying to make me come here for 7 years, and I finally did it. And I came for an interview, and it just seemed so nice, and the staff were so friendly, and they've really helped me in many other ways than I can describe. And I just like the atmosphere, and I like the people. That my friends are just on the course, they'll be friends for the rest of my life, I would think. And I just love it. I can't describe how much I've enjoyed this college, and I'm actually going to be sad to leave. So
I chose to study acupuncture for quite a few reasons, one of which is from my own experience of injury. I was treated with acupuncture, and I was quite encouraged and amazed by the results, and I really felt that it was something that I hadn't explored that was out there. The other reason is I'm a Pilates instructor, and I get very frustrated having to refer people on constantly when they're out of my realm, so to speak, and I just want to be the person to be referred on to. and see people at the end of their journey rather than halfway through. And the last reason for me particularly is working my own hours, being able to dictate when, where, a bit of autonomy with work that fits in better with family.
Really at the heart of the learning experience here is the clinic, and students start in the clinic from their first year and they're attending clinic all the way through into the final year of the course, at which stage they're almost practicing independently with just kind of light touch supervision. Classroom work is closely integrated with the different stages of your learning in clinic, so it supports the clinical work. And classroom work isn't just theory, there's lots of practical skills work there, diagnostic skills, treatment skills, body work, learning pulse diagnosis. And we also work a great deal with case studies, so real patients, examples of real patients, and we're looking at how the theory works out in those individual cases in practice. So even the theory is very clinically oriented.
This year I've really enjoyed the relationship that we've developed with the other students, and you're working very closely with the third years and got a lot more knowledge to implement yourself from the class. So can really make use of it, and I really don't think there's any better way of learning than in the clinic than having it with the real patients. It just doesn't compare to reading it in your book.
It is possible to build a really busy practice within a couple of years of graduating from the course, and then that helps to pay off the course fees, of course. Now, graduates tell us actually that they design their working lives to suit themselves. So some people have very busy practices where they're running around treating lots of people, maybe specialising in something like infertility. Other people choose to work less. They might want to fit their practice around having a young family, or they might be at a later stage in their working life where actually they don't want to work full-time anymore. So it's great that there is that flexibility and you can design it to suit yourself. But certainly it's possible to have a busy practice and earn a good living.
One of the success stories we had in clinic was an old lady of about 80 came in with sciatic pain down the leg, and she came in quite like this, in quite some pain, and we got her on the couch and she was needled, and she went to sit down to put her socks and shoes back on, and I was tidying up and I heard her whoop, and I said, is everything all right? She said, yes, look at this. And she was there putting her socks on. She said, I haven't been able to put my socks on for 6 or 7 weeks. She said, I just haven't been able to do it. And look at me now. And basically, she went out with a big grin on her face and smiling and more or less skipped out of the clinic.
I mean, I've treated quite a few children with disabilities. And yeah, that is really rewarding too. That is really, you can make such a difference to someone's life, that they don't have to suffer. You're not going to take the disability away. You're not going to cure the cerebral palsy or the autism or the Down syndrome, but you can give them much greater potential in their lives. And that's just so huge. It's quite, yeah, it's quite a big deal.